Good afternoon, everybody. My name is Eric Shulman. I'm with Sandler Training. And we're here today to talk about patient care and creating stickier patients, and how do we, running a medical office or selling into that world, what's important to us? And what is the value of a client or a patient in the medical world? And does our staff understand that? Because if they don't understand what a client, what a patient is worth to us, an awful lot of money slips through our hands. By the way, how many of you are in sales? Can I start with that? Okay, and we have some vendors in here. How many people in the medical field think they're in sales?
None.
Zero.
Yeah.
Sales is against their religion. They think sell is a four-letter word that begins with S. You don't use it in polite company. They call it practice development. You and I all know that it's sales. So what we're going to talk about today is how do we take people that are medical professionals, doctors, nurses, physician's assistants, and make them realize that they are part of the practice development process. Frontline. The front line is where patients and clients meet. In the sales world, it's on the phone, very good. It is face-to-face. It's in the waiting room. It's in the exam office. It's under the x-ray machine. Everybody in our offices is on the front line. Anybody who says hello to a patient, who does their vitals, gets their weight, but they've never been trained in human communication skills. Most of them are very, very good at what they do. They're a good nurse, they're a good doctor, they're a good PA, but they're not trained in communication. So one of the quotes that I use when I teach is the biggest problem with communication is the illusion that it's taken place. Why do we lose patients and clients? Have you ever had a bad customer experience outside of the medical world? Years ago, my wife walked into Kmart. And my wife is a tiny little thing. She's 4'6". She's cute as a button. I call her Betty Boop. That sort of ages me. You'll know if you know who Betty Boop is, right? She's 90 pounds. She's a size 00. Everybody hates her. Women do. But she's actually very likable. And I make good money, and she's dressed well. She walks into Kmart, and you're going to love this story, with a cover for an iPod. Her son had picked up a little cover for the iPod. It was $3.99. It wasn't expensive, and said, "Hey, Mom, I picked this up for you." He got her the wrong size iPod. Not a big mistake. So a couple of days later, she goes back to Kmart. She walks into Kmart. Now, she's got a nice size ring on her finger. She does not look like a homeless person. And she says, "I need some help." They said, "What do you need?" She says, "My son bought me this. I have this iPod. I want to exchange it for the right size." It was still in the sealed plastic wrapper. You know what they said at Kmart? "Do you have a receipt?" She says, "No, it was a present." Wasn't looking for a refund, was just looking for an exchange. The woman said, "I can't help you if you don't have a receipt." "All right, can I speak to the manager?" The manager comes over, same story to the manager. "I'm sorry, ma'am, I can't help you if you don't have a receipt." Now, this was not a $400 item or it was a $4, and she just wanted to exchange it for the right size. What would have been the right thing to do? Exchange it. They said, "No, I can't help you." She said, "Okay." And she took the unit, walked behind the counter where they were, and threw it in the trash can. And the manager said, "What are you doing?" She says, "I'm throwing it out. It's of absolutely no use to me. Why would I take it home? But I will tell you this, I'll never set foot in a Kmart again." And they let her walk out. Guys, I'm a trainer for a living. Do you know how many thousands of people in the last 10 years I've told that story to? What harm do you think that did to Kmart over the last, well, they're not even around anymore, are they? It was my wife and I put Kmart out of business. But people leave a practice. 80% of people leave a practice or a business because they had a bad customer service experience. 67% leave because of indifference. Those people didn't care. 60% said the reason we recommend somebody is outstanding service. My wife has had several neck surgeries. She's fused from C3 to T1, fused at L3, L4, has had laser spine at L4, L5. She's referred, I don't know, countless people to Dr. Paul Salwin at Orlando Neurosurgery. She's recommended probably 15 people to Dr. Patel at the Florida Spine Institute. Which side of that coin do you want to be on? Your best patients are your competition's best prospects. By the way, this is in all areas of business. When you land a big client, if you're in business to business, if you bring a new patient in, that new patient is your prospect's best, your competition's best prospect. But you have to take a look at, in our patient base, in our client base, who's susceptible to leaving and why? What does the gold standard of customer service look like? Anybody ever stayed at a Ritz-Carlton? Yeah. Ritz-Carlton Hotel basically has written the book on what excellent customer service looks like. When we stayed at the Ritz-Carlton in Naples, it was a very interesting experience. Ritz-Carlton teaches their people that if you get within 10 feet of a guest, you make eye contact and you say hello. The maids in the hallway, the guys clipping the bushes outside. We were down in Naples and we walked into we were staying at the Ritz-Carlton. I was speaking at the Florida Fruit and Vegetable Association. And my wife and I were going out and they had a little restaurant that was on the beach, part of the hotel. So we're walking around the pool area, headed out, and one of the bellhops, or one of the front desk people, in a suit and tie with a name tag, was walking at a very brisk pace, and he caught up with us. When he caught up with us, he turned and said, "How are you guys doing tonight?" I said, "We're doing fine. We're going to dinner over here." He slowed down and walked with us. I'll show you where it is, and walked us over, pointed us down, and as soon as we started to go left, he picked up his pace and went where he was going. You think that made us feel important? When a patient is standing there and someone sees them, do your people know to say hello or ask them some questions and engage with them? We've all had bad patient experiences, waiting too long, sitting there trying to get through stuff. And after half an hour, now there may have been an emergency, that's fine, but are we informing the patients in the waiting room? Listen, guys, the doctor's treating an emergency, somebody came in, was bleeding, it's going to be a little bit longer. Just being informed is half of the battle, isn't it? Mm-hmm. Do you train your people to inform them as to what's actually going on if there's a delay? I expect a lot of things. I want to make sure that my people are doing it right. So let's talk a little bit about what we expect when we're the patient. We want to be appreciated and acknowledged. When they come in, do they call you by name? Do your people learn the patient's names? I'm a member of the Citrus Club. When I walk in, I have no idea how they do it. They got hundreds of members. "Good afternoon, Mr. Shulman." I haven't been there for 3 months. How did that lady behind the counter know my name? Well, here's the thing. In a medical practice, you know who's coming in the next half hour. Dan has a meeting and Kevin has a meeting. So when someone comes in, can you try and get them to identify who it is? The favorite sound that you have is the sound of your voice. If you're in a crowd and somebody yells, "Eric," I'm immediately turning around. My mother trained me, right? Your mother trained you too. So when they hear their first name, they like that, and there's a little warm fuzzy. There's a rush of endorphins, and they feel a little bit better about being there. Oh, they remembered me. Do we set expectations? In Sandler world, we call them upfront contracts for what's going to take place, how long it's going to take. And I think I told you a story the other day. I had to go in for a medical procedure years ago to a colorectal surgeon. It was not a pleasant experience. Being bent over a table is not a pleasant experience for anybody. But when they hit me with something, a needle, and they didn't warn me ahead of time, I felt pain like I was not expecting it. If he had said, "Look, this is going to hurt, I'll give you a warrant," just bam, right in there, and it hurt. I never went back for the follow-up visit. And I've told people about that. It's been so many years I've forgotten the doctor's name. His first name was Tom, that I remember. I want to feel okay. I went in, I'm getting a little older, I had AFib, right? So my cardiologist sent me to an electrical specialist. And the doctor sat me down and he says, "You're going to have an ablation. Here's what it takes. I says, they're going to zap the nerve. He says, no, 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 back up. And he began to explain to me the heart is an electrical organ. And he explained to me what an ablation was and what they're actually going to be doing, what the procedure was going to be, how long it was going to take for me, how much longer my wife was going to wait because of the pre and the post-op stuff. It's going to be 2 hours for you. It's going to be 4 to 5 hours for her. Here's what to expect afterwards. So he informed me. I felt okay. Don't use what we call buzzwords in front of patients. The word ablation, I happen to know basically what it was, but I had a misunderstanding about it. If I don't know what that is, I'm going to go, okay, yeah, I got to get me one of those. Do I feel okay or not okay about not knowing what it is?
Not okay.
I feel not okay. When people feel not okay around you, they will distance themselves from you. They don't want to come back. When they feel okay around you, they want to stay with you. Do your people understand okay, not okay theory? About keeping a patient okay even when they're in a not okay situation. I was talking to Kevin on the way over about 12, 13, 14 years ago. I was diagnosed with bladder cancer. Now, not a fun thing, right? My doctor said if you got to get cancer, that's the right one to get. I said, why? He says it's slow growing, it does not metastasize, it only grows on the inner lining of the bladder, and it can be treated with chemotherapy that's put into the bladder that doesn't affect the rest of the body. Okay? Feel like you won the cancer lottery, right? But he explained it to me, and I felt very, very okay about the treatment as a result of that. When you come in, when my wife went into Kmart, she just wanted it made right. She wasn't asking for anything unreasonable. When you're the patient or the client, you just want them to make it right. That's all. You're looking for resolution. And do you follow up? Does your staff follow up? I'm very impressed with medical practices that call me 2 days after I was there saying, any questions? Are you having any reaction to the medication? Are you healing all right? Are you up and around? Are you doing X, Y, and Z like you said you would? The exercises if you're doing physical therapy? Little things like that make all the difference in the world. Well, they called enough to care. When they call a day or two before, just wanted to make sure you're going to make it on Wednesday at 10 o'clock, I feel, oh, that was professional, even when it's an automated call. These are the things that we look for. What typically happens is this. We get into a medical situation, you go to the doctor's office, you have a 1 o'clock appointment, you get there at 10 of 1, and about 1:45 you're starting to fume a little bit, right? Now, it could be a good reason or a bad reason why we're being delayed, but just sitting there for that extra 45 minutes, what is your time worth an hour? And it's not the $20 or the $50 an hour you get paid at work. Our time is worth many multiples of that. I feel like they're not paying attention to me. I'm being ignored. And I'm going to give you, this is a real life example. My wife is having lower back problems now. She thought it was her right hip, left hip, because her hip was really bothering her. We went to the doctor who's a hip specialist. He did an exam. He says, it's not your hip, it's your lower back. All you got in your hip is bursitis. I understand the pain, but with the nerve stuff you're getting, it's lower back. So she's now got an appointment with a neurologist. She called the neurologist that the hip doctor recommended. She got the answering machine. They said, if we're not able to take your call, we will call you back within 48 hours. That was on a Monday. On Wednesday, she called again. On Friday, she called another doctor. How much is a lower back operation put in a practice's coffers? 50 grand, 80 grand, 100 grand? Do they understand that because they didn't call her back, they lost that opportunity? She won't go back to that doctor. She's already got an appointment with another doctor. So, this is what we're looking for as patients. Number one, I want you to listen to me. How do we know if people are listening? They acknowledge what we've said, they repeat back pieces of what we say, and then they'll ask a question about it. It's called active listening. There's 4 different types of listening. There's passive listening. If you have a teenager, you know what this looks like. And they're looking at their watch, just waiting for you to shut up so they can leave. If you have competitive listening, you're listening intently, waiting for them to shut up so you can show them why you're smarter than them. Then there's combative listening, where it looks just like competitive listening. You're listening intently, waiting for them to shut up so you can show them why they're wrong. If you've ever been in a fight with your spouse, that's called combative listening. Yeah, but, you go right back at them, right? And then there's active listening, where you listen intently, and when they get done talking, you say, let me see if I've got this straight. And you repeat back pieces of what they say to them, and they go, she actually listened. She understands. That's the one that you want to be with. You have to be teaching your people that. Asking questions in a nurturing fashion. Asking tough questions in a gentle fashion. Do your people know how to do that? Do you know how to do that? Being supportive, attention to detail, nurturing. It's interesting, I was talking with somebody a little earlier at one of the booths, and we started talking about psychology. How many of you understand transactional analysis? Parent, adult, child ego states. We have these ego states that we live in. Well, let me ask you this, show of hands, how many of you talk to yourself during the day? Okay, the little voice that said, do I do that, just before you raised your hands, is the voice I'm talking about. 100% of you did that. Do I do that? Yeah, I guess I do. Okay? So where do the voices come from?
Should I acknowledge it?
Yeah, should I let him know? No, don't let him know. He might just go, keep your hand down, he'll get to it, right? Do you understand that all of your staff has these voices in their head? You talk to yourself 70% of the time during the day. You have 50 to 60,000 thoughts a day. And these voices come from what we call ego states. First 5 or 6 years of your life, your mom and dad taught you either in a very critical way, don't do that, what are you, stupid? Or in a nurturing way, honey, it'll be all better, it'll be okay, you tried your best. Nurturing parent versus critical parent. We have child ego states, natural child, adaptive child, rebellious child, and then we have the adult, which is logic, which started when we became self-aware around 5, 6, 7 years old, when you realized that you were not the center of the universe, that everybody had their own movie, and you played, that my life wasn't a movie starring you, right? And these voices are in your patients' heads, and they respond well. When somebody is hurt, they're in an emotional state, right? When you're sick, so you're coming from your child. My child hurts. Oh God, my hand, what am I going to do? And that's child. When you walk into the hand specialist, you're hoping they can help you with your hand. And if they say, well, you were really stupid to punch the wall, that's critical parent, isn't it? You don't like that. Wow, what happened? That's nurturing parent. They respond well to do your people understand how to approach people from an emotional level? Are you teaching them that stuff? Most people never learn this stuff. Most people go to the grave not understanding all of this stuff. It applies to every situation. The stuff that you learn here, you apply at home, you apply at work, you apply with your spouse, with your children, with the people that work for you, with your patients, with your clients, with the people you interact with in the hall, with the people at a restaurant. It's the human condition. And yet most of us get all of our technical knowledge, but we never learn how to communicate with people and what real communication looks like. The customer, in your world, it's the patient. I couldn't change the graphic on this one. The patient, you, and the practice would be the company. That's the relationship triangle. And we receive a lot of complaints. They didn't get to me in time. They didn't answer my questions. They made me feel dumb or stupid. It took too long for them to get back to me. And most people in a medical practice are trying to please the boss, not the patient. They're trying to keep their job. They're in job preservation mode. True?
Very true.
So what does this mean? So let's talk a little bit about what is a patient really worth. I'm coming in today for an office visit. I'm going to pay my $20 deductible, right? But what does the medical practice get paid? I went online and I found out that an average office visit is about $200, give or take, when you combine specialists and GPs. And you may only get $20 or $30 or $50 in the deductible, but there's another $100 or $150 that comes from the insurance company or from Medicare or Medicaid. Can we use that as a baseline? If your number is 100, you'll cut every number I've got in half. If your number is 400, you'll just double it. So I get sick. I come in for a visit. They give me something. There's normally 1 or 2 follow-up visits, right? So if we figure 2.5 visits per incident. That means that an average illness is worth about $500 in revenue. That doesn't include x-rays or labs or any of that to the practice. Not a tremendous amount of money. It doesn't even pay one person's salary for the week within the practice. How many times do people get sick? In the age bracket of 45 to 65, the average person goes to the doctor about 4 to 5 times. I used a lower number, the number of 3. So we go 3 times a year. Now my wife has 2 doctors that she goes to every month, her GP and her pain specialist. So she's got 24 visits a year, 24 times a year, and that doesn't count what's going in for the hip doctor and the spine doctor or the digestive specialist or the endocrinologist. So 3 issues a year, so that's about $1,500 a year in revenue from a patient. Again, not a lot of money. How many years does an average patient stay with your practice? How long does an average patient stay? Any guesses?
2-3 years.
2-3 years? I've been with my family practice guy for 40 years. Average patient stays 10 years. So that means I'm worth a whopping $15,000 a year over the 10-year period to the practice. I'm starting to become a little more important. If I refer 2 patients a year, if Dan comes to me and says, Dan, you got a good spine guy, you got a good digestive guy, do you know anybody who's a specialist on fibromyalgia? Do you know a good dentist? Do you have a good optician? Is it fair to say you'll refer 2 people a year to a doctor or a medical office that you're happy with? So how much is that patient really worth? $15,000 plus 20 referrals at $15,000 each is $315,000. You know what that does not take into effect? What about their family members and how many people they could be referring? And we're going to piss them off because we're a little late today? Do you understand what one unhappy client, one unhappy patient, one person like my wife who didn't get the phone call answered in a week costs you? Does your staff understand that? And what are you doing to make sure that that patient is happy? I see by your facial expressions I've got some attention here. The other thing we don't take into account is the marketing. Some of you do marketing to bring patients in, right? You're on the internet, you're spending money on search engine optimization, you're doing outgoing emails, you're doing maybe direct mail to new move-ins in your area, you're constantly reaching out to other doctors' offices for referrals. How much does it cost to bring one patient in? Now you're in the consulting field, right? What's the average cost? You probably have that number.
I did marketing for business for medical practices as well, but
So what does it cost to bring one new patient in the front door? $100, $1,000?
I mean, just my budget alone was $2,000 a month.
$2,000 a month, and
Just
how many
expenses.
new patients were you hoping to attract for $2,000 a month?
I was in the auto accident industry, and
Okay,
I was lucky to get one.
so $2,000 to acquire a patient in that industry. What's the cost? Do you know what the cost is? You need to know what the cost is. What does it cost me to get somebody in the front door? Whether it's a restaurant or a medical practice, I'm going to spend money in marketing. I'm looking to bring people in the front door. How much does it cost me to bring somebody in? And then the second question is this. What's the cost of keeping a patient that you just spent that $2,000 or that $20,000 or that $200, whatever the number was, you got them in the front door one time. Is it cheaper to keep the one you got or to go find a new one?
Keep the one you got.
Yeah, anybody who's been through a divorce knows that, right? It's always cheaper to keep the one that you've got. The cost of losing a single patient was what, $300,000? And that's if they don't bring their family and their family doesn't refer anybody. How many people does a happy patient tell? Yeah, no, a happy patient will tell anywhere, an average of about 2 to 10 people about the experience. Oh man, I gotta die. When you go and see a movie, my wife wants to go see the remake of A Star is Born. Now we know it's going to be excellent, okay? You've got who? Bradley Cooper and Lady Gaga in it, and it's got nothing but rave reviews. So when she goes to that movie, is she going to tell all the girlfriends that she plays mahjong with about it on Monday and Friday? Is she going to tell the people she plays bridge with about it? Is she going to tell my family? Is she going to tell her neighbors about it? Oh, you got to go see X. So you've just sold somebody on going to see a movie. So how many people do you tell about when you see a lousy movie? Don't waste your money on that piece of crap, right? Don't go there. They won't treat you well. Don't go to Kmart. Let me tell you what happened. With all the moving around that we have in this state, it's even more prevalent. People move an average of once every 5 years. About 20% move rate every year. My wife and I just moved. After 18 years in Winter Springs, we moved to Altamont. So we've got to find medical professionals and labs that are closer to there than they are to Oviedo. We're looking for recommendations from people. They're going to recommend the good ones to us, not the bad ones. But an unhappy person will normally tell a minimum of 10 to 20 people about their experience. And 5 years later, if your name or your practice's name comes up and they had a bad experience, I'll say, oh, no, don't go to that doctor. Don't go to that optometrist. Don't go to that dentist. He was trying to get some medical records for one of his kids. He's got kids that are not well. And he said, I need to get some medical records. They were giving him a hard time and wanted to charge him several $100s to get a copy of the medical records. And they were giving him a hard time. He went on Facebook and says, I don't know why they're doing this to me, but I highly recommend you don't go there.
But he put their number there.
Yeah, here,
And
give them a
everybody
call.
started
Give them a
calling the
call.
number.
All of a sudden, the phone starts ringing off the hook. It's like a DNS attack on their website. He did a DNS attack on their telephone. And what happens is that he's got a couple of thousand people who follow him on Facebook. Well, now there's 2,000 people who say, if that practice ever comes up, and they said, make it stop. Okay? They could have just figured out another way to do it. So, we have a book. The book is called Patient Care the Sandler Way. There's actually a process or a system that we need to teach our people to follow. By the way, this book came out of our Strategic Customer Care program, which has been around for about 6, 7, 8 years, which is exceedingly strong. This one is just geared towards the medical practice. Number one, listen intently, listen actively. When people are talking to you, you're taking notes. And then you paraphrase or repeat back what they said. Let me see if I got this straight, and repeat it back to them. I'm going to give you another example of how this plays into personal life. Ladies, I come home at night, and my wife is there. I say, how was your day? And she says, you would not believe the day I had. Well, what happened? When I got up this morning, I tried to start the car wouldn't start. So I had to call AAA, which made me late for this, and she gives me a rundown of everything that happened. And then the computer wouldn't boot up. And what do we men do? Because we're idiots. We begin fixing it for them. Honey, I told you if the car didn't start, you should have done this before you called AAA. And you could have just done this to the computer. And you ladies love that, don't you?
Oh, yeah.
Oh, you hate it with a passion.
That's, yeah.
Guys, the ladies do not want us to fix it for them. They just want to vent. What the good husband, what the husband who knows active listening does is says, wow, sounds like you've had a horrible day. The car problem, the computer, that idiot at the beauty parlor. Honey, can I take you out to dinner tonight?
Yes.
Would that help?
Yes.
And here's what she's saying. He actually listened. Guys, they don't want us to fix it for them. When a patient comes in and they want to download a bunch of stuff, sometimes they just want to download the stuff. They don't want you telling them why that you messed up or what you could have done differently. They just want to know that you listened. So the key is this: shut up and let them talk. There's something we teach called the 70-30 rule. The patient, the client, the spouse should be doing 70% of the talking. We should be doing less than 30%. And the ratio I used to say is this: God gave you 2 ears and 1 mouth, use them in that ratio. What I now say is this: God gave you 2 ears, 2 eyes, and 1 mouth. Use it at an 80-20 ratio. It's even better. Listen and look 80% of the time. Talk 20% of the time. You'll have plenty of time to talk at the end. 20% is 12 minutes out of an hour, right? 30% is what, 20 minutes out of the hour? 18 minutes out of the hour. My math is off today. It's a Saturday. The mind isn't fully functional. So listen intently. Number 2, prove you're listening. So what I hear you saying is, that's active listening. Number 3, don't get emotionally involved. We talk about in the medical profession remaining medically detached. You can be empathetic, but you can't be sympathetic. Number 4, Validate the patient. You know, you're not the only one who's told me about this. You're not the only one having this problem. When we talk about the fact that misery loves company, misery truly does love company. Number 5, ask them questions. Be interested. And this is part of doing a diagnosis. In the medical world, what do they call writing a prescription before you've done a proper diagnosis? What's that called? Illegal. Malpractice and illegal, yeah. And it's the same thing in the sales world, and the same thing in patient care world. Making recommendations on a solution before you fully understand the problem is malpractice. Number 6, if we've screwed up, look, I'm really, really sorry. It's our fault you had to wait the extra 20 minutes. Let me try and get you through this quickly. Solves a variety of sins very, very quickly. You know, you're not wrong, we were wrong, we should have gotten back to you more quickly. Be politely powerful. Sometimes they will try to bully you. You ever have anybody call up and they were angry and yelling on the phone? And you're the one that could fix the problem for them, right? Here's the Sandler rule: when under attack, fall back. I don't think it says it up there. You know, Dan, it sounds like you're angry. Let me ask, are you angry at me or angry at the situation?
I don't like the situation.
It sounds like you're angry at me. And Dan, am I the one who caused this problem, or am I the one who you're hoping could fix it for you? Look, why don't we do this? Let's both take a step back. Let me come over to your side, and let me see if I can make this happen in a way that makes you happy. Would that be okay?
Absolutely.
Going a little bit not okay, taking responsibility. You know, I know that he's wrong, okay? He didn't call when he should have. He's the one who screwed it up, not us. But by saying, you know, look, it might be our fault, immediately you diffuse the situation. They're not anxious anymore. Deliver a solution. They're looking for solutions. Give them choices. We can do this, we can do that, we could do this. Personally, I'd recommend this. What do you think? That's all they want. They want control of the situation back. Give them choices. If they're being a PITA, a pain in the ass, you have to be politely powerful. You know, look, sir, if you keep yelling at me, I'm not going to be able to stay on the phone. That's not what you want. That's not what I want. How do we fix this? And what happens is, go back to the parent-adult-child stuff, their mother whispers in their ear, you're being an ass, cut this out. Their 6-year-old says, okay, mommy, because you were taught to be polite, and they lighten up and they take a step back, and you diffuse the situation. That's what our job is when we're professionals. And thank them. When they complain, thank them. I really appreciate you bringing this problem to my attention. Next. Couple of rules. Sandler is a rules-based process. It's not script-based, because people don't learn scripts, but they can learn rules. Number 1, he who angers you conquers you. When someone gets you emotionally involved, they're now in control of the situation. So never get emotionally involved. Any of you ever taken an acting class, or anybody ever been on stage in a play or anything? Not too many of you. When an actor gets on stage, they get into what's called into role, correct? They put on the costume, right? This morning I was, running around the house looking like I do on a Saturday, looking like you do on a Saturday, and I had to come over here and do this, so I got into costume, right? I'm now in presentation mode. I wore a black suit, I wore a red shirt, I got matching red socks with mustaches on them, right? Having a little bit of fun, but this is my costume, and I got into the role of the presenter today. This afternoon, I'll be in the role of the guy who's cleaning the garage. Different role. I'll be dressed differently for that role. Actors get into role before they go on stage. Does your staff understand that when they step into the medical practice, when they sit down behind the reception desk, when they walk into the exam room, they are who they are, but they're playing the role of the medical professional who cares, who's politely powerful, who doesn't take abuse, who listens intently. This is the role they've been cast in. Disney doesn't call it the employment center. What do they call it? Disney casting. And you're being cast as the janitor, cast as Mickey Mouse, cast as the guy who runs one of the rides. Think about that. You're not hiring people to fill a role, you're casting them into the role they're going to play. Not everybody fits every role. A guy who's 6'5" is not going to play Mickey Mouse. He doesn't fit the role. Going not okay can help. Struggling a little bit, sometimes in front of somebody. This is something that especially men have trouble with, because we were taught never let them see you sweat, right? You women do not okay naturally. You get stopped by a policeman. I'm sorry, what did I? And you cry. I tried it. I cry. I still get the ticket, right? But going a little bit not okay, people feel compelled to rescue you. Another Sandler rule, express your feelings through third-party stories. I told you the Kmart story, and you went, oh, I understand that. You all learned through stories as children. Your mother didn't say not lie and you stopped lying. She told you the story of the boy who cried wolf over and over again until you understand, oh, that's why you don't lie. Sandler rule, if you feel it, say it, and I added the word gently. Sometimes you've got to say stuff, and you got to nurture it up a little bit, and it's sometimes a little bit harsh, but if you do it in the right tone, you can say something to almost anybody. You can say something to almost anybody if you do it in the right tonality. By the way, I'm not teaching communication theory today, but tonality is 38% of face-to-face human communication. Any idea what the percentage of the words are? I'm talking to you right now. What percentage are the words? Take a wild guess. 10? Anybody got a better guess? What do you think? When I'm communicating to you face-to-face, what percentage is the words? I'm not moving.
What was the other percentage?
38% is tonality. How much is the words?
I'm on the high end. I want to say like 80.
80%. He was right, 7%.
Oh, okay. I'll go ahead.
55% is physiology. Anybody in here ride a motorcycle? In the back there? Yeah, one guy. If I rode the bike here today and showed up with my do-rag, my chaps, my Harley's owner group vest, saying, all right, we're going to teach you guys how to treat your patients right, you'd look at whoever invited me saying, what the hell is this guy doing here? My costume wouldn't be right, right? I wouldn't look like the role, so I got into the role. Basically, behavior, attitude, and technique. Are we doing enough of the right behaviors? Do we have the right attitude as we approach the patient? And do we have the skill set necessary to do it? The first few minutes. What can you tell about somebody in the first couple of minutes of a conversation? I can tell whether they're angry or happy. I can see whether they're closed off, arms crossed, legs crossed. I can look at their facial expression. Are they angry? Are they happy? Are they neutral? If I'm in a situation where I'm talking to people, do you watch their feet? In a networking situation, somebody's got a foot out like this while they're talking to you, they're trying to get away. They're waiting for you. Oh, great, good, I'll talk to you. They're looking to walk away from you. Are they facing you and engaged with you? Do you match and mirror them? Do you understand this stuff? You know it by watching and looking at them. Okay, I can tell their communication style. Are they direct or are they gentle? Are they more outgoing or are they more reserved? Are they more fact-based or are they more about people and feelings? If you haven't studied DISC, you don't understand this. Do you understand primary sensory dominance? Does your staff understand it? That some people are auditory. They want to hear what it sounds like. Tell me, explain to me. Some people are visual. 55% are visual. Show me. I don't see this. I don't get the picture. They'll use visual terminology. And the remaining 25%, 20% of the auditories, are what we call kinesthetics. It doesn't feel right to them. Can I bounce this off you? If I could get a better grip on the situation. Do your people know to listen for the words that the patients are using and use similar words back? Let me explain this to you. Let me show this to you. Let me help you get a feel for this. Because if I talk like, say, here's the rule, they will not change their communication style to match ours. We and our staff must be flexible enough to change our style to match theirs. It's facial expression, body language, and tonality. You gotta watch this stuff. And again, I could do 4 hours just on that one subject, on physiology and body language, and still not cover it all. This is how it breaks out. Remember I said 7%, 38%, 55%. How you say it is 5 times more important than what you say. Your first name is? Alex. You did a good job on the Jones account. As opposed to, Alex, you did a good job on the Jones account. Same words, different tonality. Which message do you want to get, Alex? The first one. We teach people what to say, we don't teach them how to say it. You want the truth? You can't handle the truth. You want the truth? You can't handle the truth. Son, we live in a world. If Nicholson had delivered the line that way in A Few Good Men, you'd never remember the line. Okay, 38% factor. You're the receptionist. We'll get to you in a minute. That's done nurturingly. We'll get to you in a minute. That's a little bit irritated and sarcastic, right? We'll get to you in a minute. That's sort of non-caring and completely unemotional. Do your people know how to deliver that line when they're saying it to somebody in the waiting room or in the exam room? Do you teach them this stuff? No. You're sending them to get their CE credits for their medical background. Do you teach them how to interact with your people? Most businesses, most medical practices especially don't, because you're trained professionals. Two-way activity. I'm running a little bit out of time here. You got to listen more than you talk. And you got to pay attention to, are they actually listening and are they getting it? Some of us adapt our style very easily. Others are sort of locked into how we communicate. And that sort of limits you. I'm what you call a high D personality. I'm very, very direct and very task-oriented. 10% of the world is like me. If I don't change my style, do you understand that I can only talk to or sell 10% of the world? Because I'll piss off the other 90%. I've got to learn how to be a little less sharp on the elbows as I approach people, because I can cut people just walking by them. So I've got to learn how to soften. I've got to learn how to nurture. I've got to learn how to let I got to learn how to let go of control, because D's want control more than anything else. A lot of doctors are DCs or CDs. They'll tell you how it gets done, the order it gets done. There will be a checklist involved, and if you don't like it, tough. That's the way it is. But if you learn how to nurture, you can have people want to do what it is that you want them to do. But you got to take a little time. Matching and mirroring physiology. Somebody's got their arms crossed. I'm going to be like this, or at least like this when I talk to you, because it says I'm like you. Okay? Somebody who's leaning back with their legs on the desk, I'm leaning back, relaxing. Why? Because I'm like them. Sandler rule is this: they will not change their communication style to match your communication style. We have to be flexible enough to change our style to match their style. Okay, adapting style. I'll open up for questions. By the way, I went through about 25 hours of training in 45 minutes, so I know there's a lot of holes in that. If anybody would like to have a further conversation, the way we normally do this type of training is we come into an office, because you've got 8, 10, 12, 20 people there. It's a whole lot more cost effective for us to come in before you guys open up in the morning. I train optical offices, I've trained dental offices, I've trained different types of practices this way, where we'll actually come in and do a program in the morning before they get started, and then they use that skill set over a period of weeks. They completely change how they approach. If anybody does want to have a conversation, my email address is eric@sandler.com. Please feel free to pop me a note. Guys, thank you so much. Appreciate you being here. You can applaud now.